Hi everyone, welcome to another quick class in our series about dynamic seating clinical indicators. Today we're going to talk about our final clinical indicator, and that is improving function through the use of dynamic seating. My name is Michelle Lang. I'm an occupational therapist in the Denver, Colorado area. So we've talked about a lot of various clinical indicators for this dynamic seating intervention, whether it's at the hips, the head, the feet, other areas of the body. If you're interested in that information, I would encourage you to check out some of those past brief videos. But today we're going to function on using this technology to improve function. So dynamic seating has been shown through a number of various studies to improve function for a client, and you can see some of those studies listed here. Specifically, we know that research has shown an improvement in control of the upper extremities, and this young lady here is showing how use of a dynamic back is helping her to better self-propel her manual chair. She does a better job than she did in her static back. So again, these studies specifically point to a change in control of the upper extremities. We also have a study that specifically shows an improvement of access and use of assistive technology devices, and that's from Tim Adlam in 2015. And we have many people, including myself, other clinicians and suppliers, working with people who use dynamic seating who have noted changes to function. We have a couple case studies on the Seating Dynamics website that highlight some of these changes in function. Robert here on the left demonstrated an improvement in his ability to access, to control his communication device once he started using dynamic seating. And again, on the right here, we saw that Amanda is able to better self-propel her manual wheelchair. Other specific examples from the literature include the following: reduced energy consumption, increased range of motion and movement. Now, some of this, of course, is rather intuitive. Dynamic seating provides movement, and it allows for more active range within a seated position. Also, there's findings of increased social participation, and that's an important functional difference as well. Specific medical changes that have been seen include improvements to digestion, breathing, vocalization, and even visual field. Again, all related to the initiation of use of dynamic seating. So what's the bottom line? Well, dynamic seating can lead to improvements in function, including some medical functioning that we've seen. While the main purpose of dynamic seating, again, is not therapeutic, we're not trying to force a client to exercise, to increase muscle strength, to increase functional abilities within their seated system. If this person can benefit from dynamic seating, these are very nice results that are often seen as a result of that intervention. So very important to keep in mind. There's a lot of references in this brief video, so I would encourage you to check out our literature review at the Seating Dynamics website, where all of these references are listed, including links to the articles as available for public viewing. And finally, I want to share our contact information. If you have any questions, if you have comments, if you want to discuss some of this, feel free to reach out. Contact myself or contact someone directly at Seating Dynamics. Thanks very much.